So our next guest speaker is Sarah Downey, President and CEO of the Michael Garron Hospital. Sarah Downey is a senior healthcare leader whose career spans 25 years across a broad range of hospitals, including community, academic, and complex multi-institutional organizations. In 2015, she was appointed President and CEO of the Michael Garron Hospital, a large community teaching hospital in Toronto. In her current role, she is responsible for a $500 million redevelopment project and is part of the East Toronto Health Partners, one of the first Ontario health teams. She has held progressive leadership positions at the Centre for Addiction and Mental Health, the University Health Network, and the Ottawa Hospital. Sarah has made numerous contributions to healthcare in Ontario through her leadership of cancer and mental health programs, capital and strategic planning, workplace safety and wellness, and community building. Sarah has served many provincial and national committees and boards. Currently, she is a member of the Board of Flexus and chair of the Ontario Hospital Association Board of Directors. Sarah is also the recipient of the Trudeau Medal, the highest honor awarded by the Ottawa Telfer School of Management to its alumni. Sarah has a Bachelor in Science in Biology from the University of New Brunswick and a Master's of Health Administration from the University of Ottawa. She holds a Certified Health Executive designation with the Canadian College of Health Leaders and is fluently bilingual in French and English. Please welcome Sarah Downey.
Everybody's going to struggle with this tonight, let me tell you. Good evening, TNO board members, TNO leaders and staff, community ambassadors, and fellow members of the TNO fan club. I bring you greetings on behalf of Michael Garron Hospital and heartfelt congratulations on your 37th AGM. TNO is a remarkable organization that leads the way in providing essential services in some of our city's most socioeconomically challenged neighborhoods. Together, our organizations have led the way throughout this very long pandemic and created a world standard for community-based COVID testing and vaccination. Like my colleague Anna and these many posters, I want to particularly acknowledge the incredible successes of the people in the green t-shirts, the community ambassadors in this year's remarks. As we all know, COVID-19 had the potential for rapid spread and devastating effects in densely populated neighborhoods like this one. So many people that live in towers are essential workers in sectors like supply chain, grocery stores, manufacturing, food services, transportation, etc. They needed to keep working, and we needed their services. So, as much as Michael Garron Hospital is a trusted provider of health services in East Toronto, it takes so much more than a hospital to protect a community. That's why we have worked so closely with our long-standing and trusted partner, TNO, to set up a testing center in this shopping plaza in a spot that was both convenient and discreet. We started this first in Toronto community-based testing program in June 2020, after only a few months of being into this pandemic. And we figured out how to build trust and connect with residents in neighborhoods like this through the concept of the community ambassadors. The hospital would bring the staff to do the technical aspects of testing, and we would work with people who are knowledgeable about and trusted by the people living here. The community ambassadors would reach out to share information and encourage testing within the community, and TNO would support families who tested positive for COVID, an end-to-end service. And so community ambassadors established relationships with property managers and businesses to distribute masks and PPE to the residents. Every day they would go out, post and distribute Toronto Public Health flyers in building lobbies, informing residents of the importance of masking, social distancing, and hand washing. They put themselves on the front lines of the pandemic and showed courage to protect their communities. And once vaccines were made available, community ambassadors worked to promote attendance at our vaccination clinics like the one right here and helped us run mobile clinics. To give you a sense of size, in this very space, we delivered more than 300,000 doses of vaccine. And in fact, today marks the 1-year anniversary of the world record we set with TNO and other partners at the Scotiabank Arena. There's a picture over here with 26,771 doses delivered in one day in one location. At its peak, TNO had over 83 community ambassadors supporting 60 apartment buildings working in Thorncliffe Park, Flemington Park, and Taylor Massey. And in addition to our clinics, we blanketed these neighborhoods with mobile vaccine clinics. Can you imagine that we held more than 500 mobile clinics with the community ambassadors? We vaccinated in parks and school parking lots, around local grocery stores, outside mosques and TTC stations, in the lobbies of apartment buildings, at museums, walking up and down the Danforth, everywhere across East Toronto. Our collective impact is extraordinary. Former City Councillor Joe Cressy told me a little while ago that Toronto Public Health is frequently called by major cities around the world, asking how Toronto achieved the vaccination rates it did. Our success lies at the feet of these community ambassadors in TNO and an approach to vaccination that is rooted in health equity. But behind the numbers are the inspirational stories of human connection. When I was feeling down during this pandemic, I'd go to Ravi or Ahmed or Shalina and I'd say, give me an inspirational story to keep me going. So here are a couple. The community ambassadors came into contact with the patriarch of a multi-generational family living in Thorncliffe Park, who was very resistant to getting the vaccine. Through countless conversations, the ambassadors were able to change his mind by dispelling the misinformation he had about the vaccine being a chip to track people, sharing the ambassador's own experience with COVID-19 and the vaccine, and information about personally knowing people who had passed away from this deadly virus. After he was convinced, his elderly parents got vaccinated. Then a couple of hours later, he returned with his wife and his 5 children to get their vaccinations. And then his extended family decided to come. When the patriarch was convinced, 27 people got vaccinated. Another inspirational story is of a community ambassador promoting vaccination among apartment dwellers, door to door, when a clinic was being held in the lobby of the building. As 2 ambassadors went door to door in the tower, they encountered a young mother who spoke little English. As the ambassador spoke her language, they learned that she had recently arrived in Canada. She was holding her infant child and had 2 more children under the age of 5. She explained that she wanted to get the vaccine, but that her husband was at work and she would not be able to come down with her 3 children. Our community ambassadors offered to babysit the children while she got vaccinated. When the woman got to the lobby, she was greeted by another community ambassador who had already been informed of her situation and rushed her to the front of the line. She was back in her apartment building, in her apartment in less than 30 minutes. I'm so immensely proud of the work TNO and MGH have done together over the past many, many years. I know that there's more to do, and we will be your greatest champion as we continue this great work together. Thank you, and happy AGM.